Welcome back. Again, I'm Dr. Frank Springob from Port Angeles, Washington, and we're here to talk about the third video in our mini-series about morphogenic field technique. So if you recall, in the first two videos we talked about using the morphogenic field to gather information from the body. In our last video we talked about the foundations kit, how we like to make sure the foundational nutrition is handled before we move on to the clinical phase of our procedure. So in the clinical phase of our procedure, we begin with this next kit, and this is a kit we're very proud of. We call it the morphogenic protein kit. In this kit, we have the energy of 190 different cells. Some of them are normal cells and some of them are abnormal cells. Now, we use this kit to replace the body scan that many other muscle response testing techniques use. And we use the field. This is the kit that allowed us to go from testing on the body to testing in the field. It was an amazing idea. Autumn Smith came up with it, and she basically asked the question, why are we doing muscle testing with organs when organs come from tissues and tissues come from cells? Wouldn't it be a better idea to go talk to the cells first? And I said, yeah, that's a great idea, but how are you going to do that? And she even came up with a solution for that one. So as you'll learn if you come to the morphogenic field technique class, we took and we created our technique after we created this kit. So the cells in here are divided up into general categories, and there's 58 different groups of cells. And down here we have two very special energies. These are called our enhancement energies. So one of the problems you run into with muscle response testing is either the practitioner or the patient has such a low field of energy around their body that it makes muscle response testing very difficult. And for people who have been muscle response testers over the years, when you first started, you probably realized how difficult it was to do a muscle response test on somebody when your energy levels were low or if their energy levels were low. So we created some field enhancement energies to ramp up the field to give us information for even the sickest person. And then we expose people to our morphogenic protein energies. So when we find a cell energy is attracting to the field, we isolate it, we pull it out, have the patient hold it. The very act of having them hold these cell energies again ramps up the field so we get even better information. It's a lot like a radio station. You have a 5,000 watt radio station which puts out a signal you can hear for 10 miles away, or you have a 50,000 watt radio station that you can hear from 50 miles away. We want that bigger signal. So a lot of what we did in designing this technique was to create these large signals that would give us very accurate information, which led to very specific protocols for the patients. So once we learn that the body has an attraction to one of these cell energies, we are going to ask three questions of the cells. And question number one comes from the blue kit. And this is our immune kit, and we're going to talk more about this tomorrow, but right now we're going to answer question number one. And question number one is going to be, does the cell have an immune challenge? Okay. The other two questions coming up are going to be, is there a toxicity related to the cell? And question number three is, if there is no immune challenge and if there is no toxicity, what are we going to do to just feed the cell? That'll be question number three, which we'll talk about tomorrow. So let's begin by talking about immune challenges. So we are unique in that we understood early on that a lot of the people that were coming in had issues with parasite energies. Now, we don't call them parasites, we call them detrimentals. And the reason we like to use the term detrimental is because it doesn't use the word parasite. And we always end every conversation with the word energy, because we're not allowed to treat parasites, but we are allowed to treat energy. So on page one of the blue kit, we have our energies. So we will have the patient hold the cell energies that show up. We will expose the field to these to see if there's an attraction here. If there is, we will identify what the attraction is, and we will support that nutritionally with our immune protocols. So we are dialed in to find those parasite energies. And I knew that this was a problem because of conversations I'd had with practitioners over the years, television shows like Monsters Inside Me, where the narrator says, everybody's got them. Well, if everybody's got them, how come nobody's finding them? Nobody's doing anything about them. So we're dialed in for that. We're very accurate. If you come to a morphogenic field technique seminar, you will be finding these parasite energies. Okay, and then we find the protocol for that person, we have them hold that, and we see, does that solve the cellular attractions that are showing up? If it does, we're done with that. If it doesn't solve it, then we move on to the next phase, which is there a toxicity relating to the cell energy that's showing up? Or is there a situation where the cell is just starving and we need to feed it the right nutrition, which we will be talking about tomorrow. So in our segment tomorrow, that is what we will be discussing. You will get to the next section, is there toxicity? And when we talk about that tomorrow, you'll see all the different environmental toxins that we have to deal with. If you really want to get your patients healthy, you just have to acknowledge that these things are an issue in our environment and understand that if you can't discover them and move the patient in the right direction, they're going to have a very difficult problem getting them to really heal. Now, our goal in doing all this always is just to get the big and balanced field. We do not overpromise, but we do overdeliver. And when you promise people that they will feel better if you can expand and balance their field, you can take that one to the bank. So tomorrow we will be discussing cell energies as related to immunity. Then we'll move on to the next phase of our testing, which is fatty acid balance. And fatty acids play an important role in inflammation. So at the end of our video tomorrow, we'll invite you to attend a morphogenic field technique seminar if you find this interesting information, and we'll have a special offer for you tomorrow should you sign up for the seminar. So once again, thank you for listening, and we'll see you tomorrow morning.